For the last 10 years, our group is working on this single idea, to develop a new treatment for the bacterial infections and medical implants, like hip or knee implants. 10 years, that's a lot of time, right? You probably wonder, why do we care? Why do we insist? Well, we do care because in the US only, every year hundreds of thousands of devices get these infections that cannot be treated with antibiotics. Why? Because these bacteria like to come together, attach to each other and on the surface of the implant, and create this slimy structure called biofilm, where they can stay protected from their enemies, the antibiotics. As a result, the current standard of care for those infections includes additional, multiple surgeries for the replacement of the infected implant. That leads not only to extreme pain and discomfort for the patient, but also to higher risk for reinfection, and of course a huge financial cost of almost $6 billion every year for the healthcare system. Instead of that, we say, what if we could heat up remotely the infected device with magnetic field and kill the bacteria right there without even opening up the patient? We propose the thermal treatment of those infections. And the truth is that all these years, people in our group have worked hard and they showed that the thermal treatment actually works. It works on different types of biofilms with different population, architecture, types of bacteria. It works with different combination of temperature and time duration for those thermal shocks, as we call them. It even works great when it's combined with antibiotics. It works. That's good. Should I run to the hospital and announce the great news? Well, I don't think so, because we don't really know how those results that we have from the lab actually relate to an in vivo system, which is the fancy way to describe a living body. We don't really know what changes if we grow the biofilm inside a living body instead of a dish. What changes on the effect of the thermal shock if we do it inside a living body with the immune system and the blood perfusion? And of course, the question that I'm sure everybody here is thinking, what damage are we causing to the tissue surrounding the heated surface? Are we going to burn it? These are the questions driving my project, and right now we are finding that the biofilms that grow inside mice are actually smaller, less populated than the ones we grow in the lab, and they seem more sensitive to the heat treatment. So we hope that, and we continue to work on this project so that by the end of it, we can say that we took a small step closer to the clinical advancement of a new therapy for the infections that threaten hundreds of thousands of patients around the world every year. Thank you.